guys, I'm Kenya Brown. Welcome to Black Health 365. And today we are talking about something that may not always be talked about in conversation, the baby blues. Now, today is Maternal Health Awareness Day, a time to focus on women's mental health, especially the changes that can come right after giving birth. Becoming a new mom brings many physical, social, and emotional changes. While it's normal to experience baby blues, mild mood swings, tearfulness, or irritability that usually last a week or two, it's also important to know when these feelings may be more serious. Sometimes emotional changes can signal postpartum depression or postpartum anxiety, which need attention and treatment. Recognizing these signs early and talking to a healthcare provider can make a big difference for both mom and baby. Here to discuss the baby blues, postpartum mental health, and treatment options is University Hospital's psychologist and women's behavioral health expert, Erika Kelley. Hi, Dr. Kelley.
Hi, it's a pleasure to be here.
Absolutely. So, we're going to get into it talking about the baby blues. Now, what are the baby blues and how common are they for new moms?
Yeah, the baby blues typically show up within several days immediately after having a baby, and they tend to last just about up to 2 weeks. So, this can be variations in your mood. So, maybe you're crying at commercials you don't usually cry at, right? Just feeling a little bit more emotionally sensitive, irritable, difficulty sleeping, maybe overall restless. I would say a majority of women do experience some level of baby blues, even up to 80% of new moms can experience that. Typically, they do go away on their own, so they resolve without treatment. And one way to identify them as different from postpartum depression is that they don't tend to affect your functioning, like they don't affect your day to day ability to get things done.
Now, a question, does do the drugs that you use during delivery, do those affect whether you might have a little depression or baby blues afterwards?
The strongest risk factors for postpartum mood or anxiety disorders actually tend to be some other variables like past mental health history or exposure to traumatic events, lack of social support. So, there's some other variables that actually are stronger predictors of postpartum mental health conditions aside from like conditions of the delivery itself. So, I'm not aware of any research specifically on the medications during the delivery that would affect that risk in a large portion of women.
Okay. Now we're talking baby blues. Now tell us the difference between baby blues and depression.
Sure. So postpartum depression tends to be more persistent or pervasive. So, what I mean by that is the symptoms occur most of the day, most days of the week, and they do affect your functioning. So, they do affect your ability to get things done, take care of the baby, maybe engage in your typical social or recreational activities. Core signs and symptoms would be things like really low depressed mood or a lack of interest in things that you used to appreciate or enjoy. You're maybe not looking forward to things that you used to look forward to. Your motivation is low, difficulty sleeping, difficulty concentrating. Maybe you feel physically slowed down. We also tend to see a lot of excessive guilt. And unfortunately, that's really hard in the context of mom guilt that we see a lot. But feeling like you're letting yourself or others down tends to be pretty characteristic of postpartum depression. Now, again, different from baby blues, these are persistent, pervasive, they're occurring most of the time, and they don't tend to go away without intervention or treatment.
Okay. Now, how should postpartum depression be managed?
Mhm. So, postpartum depression is a medical condition. So, typically does require some type of treatment. When we see mild depression, mild intensity, you can look at options if you're not ready to jump into medication. So, you can look at therapy options. So, things like cognitive behavior therapy or interpersonal therapy. When we see moderate to severe postpartum depression, the recommendation typically is medication and or therapy, and there are a number of different medications that are approved for depression. Most of the research in the context of postpartum depression focuses on antidepressants because if you are lactating, so breastfeeding or pumping breast milk, sometimes you want to take that into consideration when you're looking at your treatment options. And then we also have some other options for support. We have at university hospitals, we're lucky enough to have a perinatal intensive outpatient therapy program. So that's more intensive therapy program that's really lovely and available to new moms. There's support groups, so a lot of great resources. The other things that I encourage women to consider is engaging in self-care. So this would be regular exercise. We do have research for mild depression that moderate physical activity is effective for managing those symptoms, and making sure that you're engaging in regular like hygiene, your good diet, you're getting good sleep. Sleep is one of the biggest risk factors for postpartum depression. But I do know moms a lot of times run into that guilt feeling like I don't want to, be apart from my baby or my family. I feel bad if I'm going to exercise.
All through.
I say that it's a need. You need to take care of yourself first.
Absolutely. And these are great conversations because a lot of us go through these things and you don't really, you want to be happy about this new bundle of joy. And, you kind of sometimes don't want to let on to the fact that you're having these other emotions, these other feelings. So make sure that you consult a medical professional so that you can know the difference in what's going on with your body so that you can enjoy your life and your baby. Now, make sure you share this video as well because, even though I had my last child at 11 years ago, things change so quickly. So make sure you share this video and it could help someone out. Now, let's talk about postpartum anxiety. How does that show up?
So there's several different anxiety disorders. So one of the more common is called generalized anxiety disorder. So this is characteristic of worry thoughts. So think of your what if thinking, like what if this bad thing happens? What if I, make a mistake as a mom? So those worries tend to focus around health and safety of the family or the baby. They are difficult to control, so you can't stop them on their own. They get preoccupying, and they're also associated with physical symptoms. So, physical symptoms of anxiety is like increased heart rate, shortness of breath. It's really hard to relax. You can't slow down, calm down. You kind of feel agitated. The other thing I like to comment on are symptoms of OCD or obsessive compulsive disorder.
Hmm.
And in the context of postpartum, those would look more like intrusive thoughts that are really distressing, you don't want to have, but are fearful. They tend to focus around fear of accidentally harming the baby or causing danger. So these types of thoughts would be things like, what if I accidentally drop the baby while walking down the stairs? Or what if I, accidentally drop the baby in the bathtub? So these are what if thoughts. You don't actually want that to happen, but they're distressing, right? To even
Yeah.
be thinking about that. So you might engage in all of these efforts to get rid of them. And that tends to get in the way of your functioning. So maybe you stop walking down the stairs or you stop giving your baby a bath, right? So they can
Oh,
really get in
no.
the way and feel
Yeah.
scary.
Yeah, you want to check these things out. Now, what's the best way to get postpartum mental health help?
Sure. So we have a number of different ways that you can get access to mental health services. You can reach out to your primary care provider, your obstetrics or gynecology provider. You can reach out directly to a mental health provider. So at university hospitals, we have our psychiatry department that has a whole host of resources and providers across the spectrum from social work and counselors, psychologists, psychiatrists. Psychologists, therapists, counselors focus more on the therapy side, psychotherapy side of things. Psychiatrists focus more on the medication management. It really depends on what types of symptoms somebody is experiencing, what level of support that they need. But really, you should be able to contact any of your healthcare providers to get a referral for mental health support.
Absolutely. You're not out here alone. There's a lot of help out here for you. So make sure you share this video. And it might even help someone you know and might help you. So, thank you so much, Dr. Kelley, for joining us today and helping us better understand the baby blues, postpartum depression, and postpartum anxiety, and why regular check ins with your doctor are so important. And as we wrap up, I want to remind all moms and moms to be listening. Your health matters. Don't wait until something feels wrong. Reach out to a healthcare provider you trust and keep up with your checkups. Call 216 307 3188 today to schedule an appointment. Thanks so much, Dr. Kelley.
Thank you.
Yes, and to learn more about our Black Health 365 program, visit wzakcleveland.com/BH365.